Hello, dedicated medical explorers and those keen to understand critical care technology. Welcome back to Life of Medical. I'm your host, and tonight, we're delving into a profoundly important medical device that often plays a pivotal role in saving lives in intensive care units: the ventilator, often referred to as a breathing machine. Our episode is titled The Breath of Life, a deep dive into the ventilator, breathing machine, how it works and when it's needed. This machine is a lifeline for patients who cannot breathe adequately on their own. Let's explore this critical technology. What is a ventilator, breathing device, and what is its primary function? First and foremost, what exactly is a ventilator, or breathing device, and what is its fundamental purpose? A medical ventilator is a sophisticated machine designed to mechanically move breathable air into and out of the lungs of a patient who is physically unable to breathe sufficiently on their own, or who needs assistance to do so. Its primary function is to aid or replace the natural process of respiration. This means it ensures that the patient receives enough oxygen and is able to eliminate carbon dioxide, which are vital processes for sustaining life. Ventilators don't cure a lung condition, but they provide critical support, taking over the work of breathing so the patient's body can rest and recover from the underlying illness or injury that has compromised their respiratory function. They are a cornerstone of life support in critical care medicine. How does a ventilator work to support a patient's breathing? Now, let's uncover how a ventilator actually works to support or take over the crucial task of breathing for a patient. Modern ventilators are highly complex and can be tailored to individual patient needs. Essentially, the machine delivers a controlled flow of air, often enriched with a specific concentration of oxygen, into the patient's lungs through a breathing tube. This tube can be an endotracheal tube, inserted through the mouth or nose into the windpipe, invasive ventilation, or it can be connected via a snug-fitting mask, non-invasive ventilation. The ventilator pushes air into the lungs, creating positive pressure to inflate them. This is the inspiratory phase. It then cycles to allow the air to passively flow out of the lungs as they deflate, the expiratory phase. Healthcare professionals can precisely control various parameters, such as the volume of air per breath, tidal volume, the number of breaths per minute, respiratory rate, the pressure of the air delivered, and the oxygen concentration, to match the patient's specific requirements. Where are ventilators most commonly used within a healthcare setting? You might be wondering, where are these life-sustaining ventilators most commonly used within the complex environment of a healthcare setting? The most prominent location for ventilator use is the intensive care unit, ICU, also known as a critical care unit, CCU. Patients in the ICU are often critically ill and may have severe respiratory failure due to conditions like acute respiratory distress syndrome, ARDS, severe pneumonia, or major trauma. Operating rooms are another key area where ventilators are indispensable. Patients under general anesthesia often have their breathing controlled by a ventilator because anesthetic drugs can suppress spontaneous breathing. Emergency departments also utilize ventilators to stabilize patients with acute respiratory distress before they are transferred to an ICU. Additionally, specialized units such as neonatal intensive care units, NICUs, for premature babies with underdeveloped lungs, and some long-term acute care facilities rely heavily on mechanical ventilation. When does a patient typically require mechanical ventilation? When does a patient's condition necessitate the use of mechanical ventilation? A patient typically requires mechanical ventilation when they are experiencing respiratory failure. This can manifest in several ways. They might not be able to take in enough oxygen, hypoxemic respiratory failure, or they might not be able to effectively eliminate carbon dioxide, hypercapnic respiratory failure, or often a combination of both. Common triggers include severe pneumonia, acute respiratory distress syndrome, ARDS, which causes widespread lung inflammation, exacerbations of chronic conditions like COPD, chronic obstructive pulmonary disease, or asthma, drug overdoses that suppress breathing, neurological conditions that impair the muscles of respiration, like Guillain-Barré syndrome or severe strokes, and major trauma affecting the chest or brain. Patients undergoing major surgery who receive general anesthesia will also be ventilated during and immediately after the procedure until they can breathe adequately on their own again. The decision is always based on a thorough clinical assessment. Why is mechanical ventilation a critical life support intervention, and what are its goals? This brings us to why mechanical ventilation is such a critical life support intervention and what its primary goals are. Mechanical ventilation is critical because adequate oxygenation and ventilation, removal of carbon dioxide, are essential for the survival of every cell and organ in the body. When a patient cannot achieve this on their own, a ventilator buys precious time by taking over the work of breathing. The main goals are to maintain or restore adequate gas exchange, oxygen in, CO2 out, reduce the patient's work of breathing, thereby decreasing oxygen consumption by the respiratory muscles, allow the lungs and body to rest and heal from the underlying condition, and prevent complications associated with respiratory distress, such as lung collapse or organ damage due to hypoxia. It's a supportive measure, not a cure, aiming to stabilize the patient while other treatments address the root cause of their respiratory failure. Who operates and manages patients on ventilators? Managing a patient on a ventilator is a complex task requiring a skilled multidisciplinary team. So, who is involved? Respiratory therapists are specialized healthcare professionals who are experts in setting up, operating, and managing ventilators. They work closely with physicians to adjust ventilator settings according to the patient's changing condition and blood gas results. Critical care physicians, intensivists, and anesthesiologists typically oversee the overall care of ventilated patients, making decisions about the ventilation strategy and managing the underlying illness. Critical care nurses play a vital role in continuously monitoring the patient, assessing their response to ventilation, providing direct patient care including suctioning of the breathing tube, ensuring patient comfort, and recognizing and responding to any complications. Other specialists, like pulmonologists, neurologists, or surgeons, may also be involved depending on the patient's specific condition. It's a highly collaborative effort. Types of mechanical ventilation: invasive versus non-invasive. It's important to understand that there are different approaches to delivering mechanical ventilation. Let's discuss types of mechanical ventilation: invasive versus non-invasive. Invasive mechanical ventilation involves bypassing the upper airway with an artificial airway. This is most commonly an endotracheal tube, ET tube, inserted through the mouth or nose into the trachea, windpipe, or a tracheostomy tube inserted directly into the trachea through an incision in the neck, typically for longer-term ventilation. Invasive ventilation allows for more precise control over breathing and is used for patients who are unconscious, have no spontaneous breathing effort, or require high levels of support. Non-invasive ventilation, NIV, on the other hand, delivers ventilatory support using a snug-fitting mask that covers the nose, nasal mask, or both the nose and mouth, full-face mask, or sometimes a helmet. Common forms of NIV include CPAP, continuous positive airway pressure, and BiPAP, bilevel positive airway pressure. NV is often used for patients with COPD exacerbations, cardiogenic pulmonary edema, or to support breathing in less severe respiratory distress, provided the patient is awake and can protect their own airway. Understanding key ventilator settings simplified. Ventilators have many settings, but let's try understanding key ventilator settings in a simplified way for a general audience. The respiratory rate, RR, is the number of breaths the ventilator delivers per minute. The tidal volume, VT, is the amount of air delivered with each breath. Positive end expiratory pressure, PEEP, is a small amount of continuous pressure applied to the airways at the end of exhalation to help keep the tiny air sacs in the lungs, alveoli, open, improving oxygenation. The VO2, fraction of inspired oxygen, is the concentration of oxygen in the air delivered to the patient, ranging from 21%, room air, up to 100%. Ventilators also have different modes, which determine how the machine interacts with the patient's own breathing efforts. Some modes provide full support, while others provide partial support and allow the patient to trigger breaths. These settings are meticulously adjusted by the healthcare team based on the patient's condition, blood oxygen levels, and other physiological parameters. The experience of being on a ventilator, what patients and families should know. For patients and their loved ones, the experience of being on a ventilator, what patients and families should know can be challenging and often frightening. If a patient has an endotracheal tube, they will not be able to speak because the tube passes between the vocal cords. They will also be unable to eat or drink normally. Communication can be achieved through writing, gestures, or communication boards. Sedation is often used to help patients tolerate the breathing tube and the ventilator, and to reduce anxiety and discomfort. Patients are closely monitored for pain and discomfort. Families play a crucial supportive role. While it can be distressing to see a loved one on a ventilator, it's important to remember that the machine is providing essential life support. Healthcare staff will provide updates and explain the patient's progress. Open communication with the medical team is key to understanding the situation and managing expectations. Risks and complications associated with mechanical ventilation. While life-saving, it's also true that there are risks and complications associated with mechanical ventilation. One common risk is ventilator-associated pneumonia, VP, an infection that can occur because the breathing tube bypasses the body's natural airway defenses. Ventilators can sometimes cause lung injury, such as barotrauma, injury from too much pressure, or volotrauma, injury from too much volume, especially in patients with already diseased lungs. Prolonged immobility while on a ventilator can lead to muscle weakness, including weakness of the diaphragm, the main breathing muscle, blood clots, and pressure sores. Some patients may experience psychological distress or delirium. The healthcare team works diligently to minimize these risks through meticulous care, infection control practices, using lung-protective ventilation strategies, and encouraging early mobility when possible. Weaning off a ventilator. The process of liberation. The ultimate goal for most patients is weaning off a ventilator. The process of liberation. This is a gradual process where the amount of support provided by the ventilator is slowly reduced, allowing the patient to take on more of the work of breathing. Weaning begins when the underlying condition that led to respiratory failure has improved significantly, and the patient is stable enough to attempt breathing on their own. The healthcare team assesses the patient's readiness daily. This involves spontaneous breathing trials, SBTs, where the patient breathes with minimal or no support from the ventilator for a period while being closely monitored. If the patient tolerates the SBT, the breathing tube may be removed, a process called extubation. Sometimes, weaning can take days or even weeks, and not all patients can be successfully weaned. The process is highly individualized and requires careful monitoring and patience. And that concludes our in-depth exploration of the medical ventilator. It's a truly remarkable piece of technology that stands at the forefront of critical care, offering a fighting chance to patients facing severe respiratory challenges. I hope this has provided you with a clearer understanding of how ventilators work and their crucial role in medicine. If you found this informative, please hit that like button, subscribe to Life of Medical, and activate the notification bell. Stay safe, breathe well, and join us next time.